The woman you see on your screen right now is one of the most dangerous, deplorable, disgusting human beings I've ever heard of. Her name is Kimberly Sayens. She's a 35-year-old nurse, but she didn't go into work every day with the thoughts of helping her patients. Kimberly had other plans, much more sinister plans, and sadly, those plans would take the lives of several innocent patients.
Back in 2008, two patients claimed that they saw 35-year-old nurse Kimberly Sayens draw bleach into a syringe and then inject the solution into the IV lines of two patients receiving dialysis. The patients immediately told the supervisor what they saw. Kimberly was sent home, and the supervisor called the police and told them what had happened.
So I went, and the first person I approached was Marlene Hamilton. And I grabbed a chair and sat down, got on her level, sat up close to her so I could have a private conversation and just reassure her what's going on, what can I do to help, and, what do you need to tell me? I understand you're upset. Miss Hamilton said, I cannot believe what I just saw. And I said, well, tell me what you saw earlier, what's going on. And she's like, I saw that nurse over there, the one with the ponytail and the one with Kim. I said, yes, ma'am. Miss Kim, the LVN. She says, yes. She was, I saw her draw up some of that Clorox. She kept insisting that it was Clorox. I saw her draw up that Clorox, and she went and injected it in that patient over there. And Miss Roan, I said, which one? And she said, Miss Roan's chair, she got sick a while ago too. And it wasn't long after she injected that. And I said, okay. And she said, and then she went and she put it in that sharps container over there by the patient on the end. She didn't bring it, and she walked over there, and then she came back over here, and she kept really looking around, acting like she was real nervous, and she didn't bring it over here, but she walked way back over there and put the needle in that container. I said, okay, we're gonna be okay, you're gonna be okay, she will not come take you off, I'll get someone else over here to take over this room. I said, are you okay? Yes, ma'am, I'm okay. All right. So then I wheeled over and I talked to Linda Hall. Miss Hall, what's going on? What can I do? I understand you're upset. And she basically gave me the same story about Kim having a bleach container on the floor, and that Kim drew up bleach from that container and stood up with the syringe right by her side and just kept looking around, watching. And I said, well, what was she watching for? And she's like, because she's just curious. And she's like, well, she was waiting for Dale, who was my med nurse that day, to walk back from where he was at with Arlene, who was monitoring him. When he had left that area, that's when she had walked over to Miss Roan's area and actually had infused what she thought was bleach into the lines of the patient.
I'm sure in the history of healthcare, there's other stories and other situations where patients have made a claim that their health provider wasn't treating them right or might have been negligent or rude to the patients. But this situation is a little different. These two patients came with the same exact story. And this story isn't something that you would just make up on a fluke.
And she gave the exact same story about how she came back over and was still hiding the syringe by her side, and then how she later had gone and disposed of the syringe in the sharps container. I reassured her as well, Kim will not be over here to take care of you. I will take care of this. You're going to be okay. Oh, and you're just not going to believe me. That's not the case. I do believe you, and I will investigate this. It's going to be okay. So there's a couple of syringes. I went and got bleach residual strips, and it has a little pad on it that you actually put a solution on, and it'll change colors if there's bleach present. I tested a couple of the EPO syringes, and there was no bleach present. Then I found a syringe, one of the syringes that had the blood in it, and tested it, and there was no bleach present. There was another syringe that actually had a needle attached to it, which was very odd and different, and had the cap on it. I removed the cap, and I squeezed out some of the solution that was inside that syringe on the tip of that pad, and it immediately changed to a dark purple, which is a very high positive measure of bleach.
And there you go. Caught red-handed, no lies told. W them old lady patients.
So being the person that I am, I'm like, well, and I've been bleaching the container and it could have seeped through here. So the only other way to do it is to pull out the plunger because nothing could have gotten inside the syringe. So I pulled the plunger out and I took this test strip, another one, and placed it inside and put it some of the solution that was there. And again, it turned positive immediately for bleach as well. There was one other syringe the same way. I tested it and it was both syringe and inside positive for bleach. At this time, Linda Stevens is here with me. I had her as a witness, plus Giselle. Giselle tested several of her syringes in there. She also reported to me that she had 2 that were positive for bleach as well.
Bingo! I got action.
Since the day Kimberly began working at the dialysis center, 19 patients had passed away, according to the health inspector. This number was abnormally high, and an investigation had already begun, long before Kimberly had been caught injecting bleach into her patients. What was interesting is that all the patients that died had all been under the direct care of Kimberly.
19 patients in the past few months, which is abnormal. Way more deaths than they usually have at this facility, and it didn't happen until Kimberly got hired. Who was responsible for her getting hired? We need to know how she got her license. Does she have a license? And where did she work previously to this?
The detectives asked Kimberly to come in for an interview. They don't tell her what the interview is about, but Kimberly is already prepared because she knew this day was coming. Without being asked, she brings up the mortality among the patients, how she gets confused easily, and how the bleach is used to clean the dialysis machines.
I don't know, these last months, I'm just scared to go to work, to be honest with you. I mean, because they can't tell us what's going on, and I'm doing everything by the book, and I'm scared because I have a license, and I'm scared if I do something, then I've lost my license. You know, the anxiety in that clinic was just, and I don't know what it is. It's just, and I know we're all new, except for a couple of people. And I have noticed lately that there's been a lot of sloppiness. If our machines are hooked up and they have some bleach in them, I haven't researched into that, but I just have to wonder what kind of reactions would happen if there was some machines, some bleach machines, not clear.
These detectives haven't even asked her anything yet. They haven't even brought up the bleach and the patients dying. Kimberly sits down and immediately gets to talking about how so many patients been dying lately. She's scared to go to work. Maybe it's something in the water. And then she brings up, well, the dialysis machines do get cleaned with bleach. I wonder if, they're cleaning them out properly, trying to lay out her own defense. No, we got you here because we know you're guilty. We need a confession.
And the only thing that I did was go over there and give her saline. And I know you're supposed to stay with your own 4 patients. And Angie was gone. And she was just moaning and groaning. Her blood pressure was down. So I gave her a little bit of saline and I charted it. And she just said, Miss Call said, what did you give to her? And I said, I didn't give anything to her. I gave her saline. Her blood pressure's dropping. And then it wasn't long. She had Miss Hamilton sitting right beside her. And she was like, did you see her give her something? And it was very frustrating because I wanted to go back to them too and say, what did you give? What did you see me give? Because all I did yesterday was get my patients set up, delve into the meds. I didn't do any meds. And I guess my patients, they come here and they want to be dialyzed and they want to get out. And I don't know what's going on here. And it's just scary. And if I'm doing something wrong, I want to know that I'm doing something wrong because I don't want to kill somebody. There's so many places around here, and it goes smooth. So I wonder, what are we doing wrong?
Kimberly explains that she wants to know why so many patients are dying. The detectives decide it's time to bring up the bleach, so they ask Kimberly how the bleach is used to clean the machines.
Can you tell us anything about the bleaching procedures?
Bleaching
Y'all have a-
procedures. We are supposed to, after we get our, well, some people do it before. You get your, there's two things in bleach back there, and it's either before or after. But you have to get your bleach bowl, and you have to get like a little medicine cup. And you gotta go all the way back there, and you gotta get that. And you pour it in your bowl.
Okay. Would there be a cause or a reason or necessity or anything like that for anyone to use a syringe to draw bleach up into?
No.
Do you use a syringe to pull your 10 cc's of bleach up?
Sometimes I do when I can't find the little medicine cups. They used to be in that truck drawer. There weren't any in there. So I knew 10 C's would make that. But I did it at the back. I did it at the back where there was blood. Because we weren't supposed to do it up here. And you just get a little 2 ml cup, you fill it with bleach, and then you put 1,000 bleach in there, and then you put your clean lamps in there.
When you use a syringe to draw up the bleach before you make your mixture up, what happens to that syringe?
If you use a syringe, they actually have little cups to monitor them.
She's saying what they need her to say to hammer the nail in the coffin. However, she's not directly admitting it, but she is saying she did not follow protocol, and her using a syringe to get bleach was clearly nothing that she was trained for. This was her own doing. So even though she's not admitting it, confessing directly, she's closing her own coffin by saying what she's saying, because she's admitting that, yes, she's going and putting bleach inside of a syringe. The witness statements say that they saw her do that and then inject it into a patient. So either way, we got her. Either way, she cooked. She's cooked. She's sizzling like some bacon.
It's just scary. I didn't know Dallas was going to be like this. The first few weeks, it seemed to go okay. You might have a bleeder or two, but having triage every day is just, and I keep going over and over my head, my books, and trying to figure out what have I done wrong.
Of the 5 patients who had died over the previous month, prosecution was able to prove that Kimberly had direct contact with all of them. They also showed the jury that Kimberly had Googled bleach poisoning and whether or not bleach could be detected in dialysis lines. This evidence, along with the co-worker's testimony stating that Kimberly hated her job and was very aggressive towards her patients, was enough for the jury to convict her of 5 counts of murder. Kimberly was sentenced to life in prison without the possibility of parole.
You've never given an interview. You didn't testify in your trial. People who know about your case will have ever heard you speak, really. Why are you doing this?
There's just a lot of things that was never said, and I believe it's time to speak out. I found myself working at a dialysis clinic that was more about money than they were about the lives of their patients. I was falsely accused of something, and that's why I'm here today. I know that I didn't do anything that would have done anything to harm another patient.
This wasn't going on before you got there, and it hasn't gone on since you left. I mean, the chances of one patient dying of cardiac arrest, about 7 in 100,000, but the odds of 2 patients dying that close to each other was described as astronomical.
Well, and I would probably agree if I knew the statistics.
But why do you think it was all happening once you joined?
Well, no, I never put 2 and 2 together like that.
But it came up in court that you told staff you didn't like the patients which you had been charged with helping.
Could that really be her motive in all of this? She went home and researched how to take out her patients because she just didn't like them. She just had an attitude. She didn't like the patients that she was paired with. No, that doesn't make no sense, because they said that she was giving syringes to patients that weren't even hers. So she wasn't even assigned to some of these patients that she killed. She just was going over, waiting for their person that was supervising them to leave, walk away, and then stick them with the syringe. That's what the witness statement said. I remember clearly the witness said as soon as that doctor would leave and walk away, she would come over, hit him with the syringe, and then walk to the back. So she wasn't even killing her own patients. I want to know the motive. Tell us the motive, lady.
That's silly. I would never say something like that.
But why would these two patients invent the fact they'd seen you?
Well, first of all, neither one of them could see. Did draw it up because I was making it for a cleaning solution.
Right.
I wasn't making it to go kill somebody.
But they're all lying, all these people.
Yes.
But why would you be asking, can bleach be detected in dialysis lines?
I've always thought it was the water system. I do know that the water treatment system, how it wasn't cleaning all the chlorine out of the lines.
It's either the water, which nobody believes apart from you and a few people, or it's you, only person that could possibly have been, because you were the only one around these machines in every single case, was you.
That's not true.
And the common theme of all of it, in the end, is you. Why did you do it?
I didn't. And why would I? I had nothing against any of those people.
Sometimes the easier thing is just to admit it. That's the path to atonement. And maybe you're in denial to yourself. You and I know you did this.
No, I did not. That don't even make sense.
It does make sense.
I really thought you were going to help me.
Help you what?
Help me to get the truth out. Thanks a lot.
I think we did get the truth out.
I guess he got in your pockets too.
I just think you're guilty. I'm sorry.
Okay. Guilty for killing people for no reason. That makes a lot of sense.
It doesn't make any sense.
Some investigators believe that Kimberly killed over 15 patients during her time at the dialysis center. However, this isn't the first medical facility she has worked for. Kimberly had been fired by previous employers, who stated in her termination letters that she was not to be rehired under any circumstances.
And that's how that story ends. Kimberly was sentenced to life in prison. Life in prison. I guess it don't get no worse than that, right? It is what it is. We can't really ask for a worse legal punishment, so we got to take that. She took a lot of lives, man, hurt a lot of families. Rest in peace to all of those that lost their lives due to Kimberly. I'm off this nasty, man. Subscribe to the channel, like the video right now if you rocking with these type of videos. I'm hitting y'all with like 2 or 3 of these joints every day and 1 nightly reaction video. So please support. I'm gone.